If you're over 60 and taking multiple medications, this conversation could change your relationship with your healthcare. I'm going to share something that most doctors wish their patients understood better, and it has nothing to do with fear. It has everything to do with partnership. Every week in my practice, I meet patients like Margaret. She's 68, takes 7 different medications, and recently told me something that broke my heart. She said she'd been experiencing dizziness for 6 months but didn't mention it to her doctor because she didn't want to seem like she was complaining. When we finally reviewed her medications together, we discovered that 2 of them were interacting in a way that was causing her blood pressure to drop to low. A simple adjustment fixed the problem within days. Margaret's story isn't unique. Research from the Journal of the American Geriatric Society found that adults over 65 take an average of 5 prescription medications daily. When you add over-the-counter drugs and supplements, that number often doubles. Each medication serves a purpose, but together they create complexity that requires active management. Here's what many people don't realize. Your body at 70 processes medications differently than it did at 50. Your liver metabolizes drugs more slowly. Your kidneys eliminate them less efficiently. Your body composition has changed, affecting how medications distribute throughout your system. This means that a medication and dose that worked perfectly for years might need adjustment as you age. Let me share what happened with Robert. He's 74 and had been taking the same blood pressure medication at the same dose for 15 years. Recently, he started feeling tired all the time. His daughter noticed he seemed confused sometimes. When we checked his medication levels, we found they'd been building up in his system because his kidney function had gradually declined with age. This is completely normal aging, but nobody had adjusted his medication dose to match his changing kidney function. Once we lowered his dose appropriately, his energy returned and the confusion cleared. The key insight here is that medication management isn't a one-time decision. It's an ongoing conversation that needs to happen regularly, especially as we age. Before we continue, take a moment to share in the comments which questions you've been wanting to ask your doctor about your medications but haven't yet. Reading through comments helps us create content that addresses your real concerns. Let me tell you about the 7 most important conversations you should have with your doctor about your medications. These aren't about stopping medications or being afraid. They're about being an informed, active participant in your own healthcare. The first conversation is about medication necessity. Ask your doctor to explain why you're taking each medication and what would happen if you stop. This isn't challenging their judgment. It's understanding your treatment plan. Sometimes medications prescribed for a short-term problem continue indefinitely out of habit rather than necessity. Sarah's story illustrates this perfectly. She's 71 and was taking a proton pump inhibitor for acid reflux. When we reviewed her medications, I asked when she'd last experienced heartburn. She thought about it and realized it had been over 2 years. The medication had worked so well that the original problem had resolved, but nobody had ever discussed stopping it. We created a plan to gradually reduce and eventually eliminate it, and she's been fine without it for over a year now. This doesn't mean you should stop medications on your own. It means you should understand why you're taking each one and have regular discussions about whether they're still necessary. The second conversation is about side effects versus symptoms. When you experience something new, dizziness, fatigue, confusion, digestive issues, it's worth asking whether it could be related to your medications rather than just attributing it to aging. Thomas is 76 and started experiencing muscle weakness and pain. His doctor initially thought it was just aging and arthritis. But Thomas had read about statin side effects and asked whether his cholesterol medication could be involved. His doctor checked his muscle enzyme levels and found they were indeed elevated. They switched to a different statin at a lower dose, and his muscle pain resolved within weeks. If Thomas hadn't asked that question, he might have suffered unnecessarily for months or years. The important thing is to report new symptoms to your doctor and ask about medication connections. Don't assume everything is just aging. The third conversation is about drug interactions. Every time a new medication is prescribed, ask your doctor and pharmacist to review your complete medication list, including over-the-counter drugs and supplements. Some combinations can be problematic. Helen is 69 and takes warfarin, a blood thinner. She started taking a daily multivitamin that contained vitamin K, which reduces warfarin's effectiveness. Nobody had explained that certain vitamins could interfere with her medication. When her routine blood test showed her warfarin wasn't working as well, we tracked it down to the new vitamin. This kind of interaction is completely preventable when everyone knows your complete medication list. Pharmacists are invaluable partners in this. Every time you pick up a prescription, mention if you've started any new medications or supplements since your last visit. They have sophisticated systems to check for interactions. The fourth conversation is about timing and food. Some medications work best taken with food, others on an empty stomach. Some should be taken in the morning, others at night. Some shouldn't be taken together because they interfere with each other's absorption. David is 72 and was taking his thyroid medication with breakfast, along with his calcium supplement. Both are important medications, but calcium blocks thyroid medication absorption. Once we separated them, taking thyroid medication first thing in the morning and calcium with lunch, his thyroid levels improved significantly. Such a simple change, such a big difference. Ask your doctor or pharmacist about the optimal timing for each medication. Create a schedule that maximizes effectiveness and minimizes interference. The fifth conversation is about monitoring. Some medications require regular blood tests to ensure they're working properly and not causing harm. Understanding what's being monitored and why helps you stay engaged with your care. Barbara is 80 and takes medications for diabetes, high blood pressure, and cholesterol. Each requires different monitoring. Her diabetes medication needs regular kidney function checks. Her blood pressure medication requires periodic potassium level monitoring. Her cholesterol medication needs liver function tests. By understanding what's being checked and why, Barbara became much more diligent about getting her blood work done on schedule. Ask your doctor which medications require monitoring, what's being checked, how often it should be done, and what the results mean. Keep a record of your test results so you can track trends over time. The sixth conversation is about alternatives. For many conditions, multiple treatment options exist. Some medications might work better for your specific situation or cause fewer side effects. Kenneth is 67 and was taking a medication that caused him to cough constantly. It was affecting his sleep and quality of life. When he mentioned it to his doctor, they switched him to a different medication in a related class that doesn't typically cause coughing. The cough disappeared within a week. Kenneth had suffered for 6 months because he didn't realize alternatives existed. If a medication is causing side effects that affect your quality of life, ask about alternatives. There's often more than one way to treat a condition. The seventh conversation is about goals and priorities. As we age, our health goals may shift. What made sense at 60 might not align with your priorities at 80. Having honest conversations about your goals helps ensure your medication regimen supports what matters most to you. Eleanor is 85 and was taking medications to prevent diseases that typically develop over 10 to 20 years. When we talked about her goals, she said her priority was maintaining her current quality of life and independence, not necessarily extending her lifespan at any cost. We carefully reviewed her medications and discontinued some that were primarily for long-term prevention but were causing side effects that affected her daily function. This was a collaborative decision made with her cardiologist, considering her individual situation. This isn't about giving up on health. It's about aligning your medical care with your personal values and priorities. Now let me share the practical framework for having these conversations effectively. Many people feel intimidated talking to their doctors about medications. They're worrying about seeming difficult or questioning medical expertise. But good doctors welcome engaged patients who ask thoughtful questions. Start by preparing for your appointments. Keep a medication journal for 2 weeks before your visit. Note when you take each medication, any symptoms you experience, and questions that arise. This organized information helps your doctor understand your experience and address your concerns efficiently. Write down your questions before the appointment. In the moment, it's easy to forget what you wanted to ask. Having a written list ensures you cover everything that matters to you. Consider bringing a family member or friend to appointments, especially when discussing complex medication changes. They can help remember the conversation and ask questions you might not think of. Use clear, specific language when describing symptoms. Instead of saying you feel bad, describe specifically what you're experiencing. I feel dizzy when I stand up quickly. I have a dry cough that's worse at night. I feel confused in the mornings but clearer in the afternoons. Specific details help your doctor identify patterns and solutions. If you're enjoying this content and finding it helpful, please hit the like button and subscribe. We create videos like this every week to help seniors navigate healthcare with confidence. Let me address some common concerns about medication discussions. Some people worrying that asking questions will offend their doctor or take too much time. Here's the truth. Good doctors appreciate patients who are engaged in their care. Your questions help them understand your experience and provide better care. If your doctor seems rushed or dismissive of your concerns, that's valuable information. It might be time to find a provider who values patient partnership. Your healthcare should be a collaboration, not a one-way directive. Some people worrying about seeming like they got their information from the internet and that doctors don't like that. The reality is that informed patients often have better health outcomes. The key is how you present information. Instead of saying I read online that this medication is dangerous, try I read something about this medication and had some questions. Could you help me understand the risks and benefits in my specific situation? Now let's talk about what to do between doctor appointments. Medication management isn't just about those 15-minute visits. It's about daily awareness and good habits. Keep an updated medication list that includes the name of each medication, the dose, when you take it, and why you're taking it. Keep copies in multiple places: your wallet, your refrigerator, your car, your phone. In an emergency, this list could be life-saving. Use a pill organizer, especially if you take multiple medications at different times. This helps prevent missed doses and accidental double doses. Set phone alarms if needed to remind you of medication times. Store medications properly. Most should be kept in a cool, dry place, which means not in the bathroom where humidity from showers can degrade them. Check expiration dates regularly and safely dispose of expired medications. Establish a relationship with one pharmacy if possible. When all your prescriptions come from the same place, pharmacists can more easily monitor for interactions and keep your records complete. Many pharmacies offer medication reviews where a pharmacist sits down with you to go through all your medications and answer questions. Watch for warning signs that something might be wrong. New or worsening dizziness, falls, confusion, extreme fatigue, digestive problems, or changes in how you feel generally could all be medication related. Don't wait for your next scheduled appointment to report concerning symptoms. Call your doctor's office. Let me share Maria's experience with proactive monitoring. She's 73 and keeps a simple health journal where she notes how she feels each day and any symptoms she experiences. When she started feeling unusually tired, she could show her doctor that the fatigue had started exactly 2 weeks after beginning a new medication. This timing made it clear that the medication was likely the cause. They tried a different option, and her energy returned. This kind of tracking doesn't have to be complicated. A simple notebook where you jot down how you feel and any symptoms is enough to identify patterns. Now let's discuss the role of deprescribing. This is the process of systematically reducing or stopping medications that may no longer be beneficial or may be causing harm. It's an important concept that more healthcare providers are embracing, especially for older adults. Research published in JAMA Internal Medicine found that deprescribing potentially inappropriate medications in older adults can improve quality of life without adverse effects. The key is doing it systematically and with medical supervision. George is 79 and was taking 9 medications when we first met. We spent several appointments reviewing each one, discussing his priorities and concerns, and carefully stopping or reducing medications that were no longer serving him well. We did this gradually, monitoring carefully for any negative effects. Over 6 months, we reduced his regimen to 5 medications. He reports feeling better, more alert, and more in control of his health. His blood work has remained stable, and he's had no adverse effects from the medications we discontinued. This doesn't mean fewer medications is always better. Some people need multiple medications to manage complex conditions effectively. The goal isn't to minimize medication numbers arbitrarily. It's to ensure every medication you take is necessary, appropriate, and beneficial for your specific situation. If you're interested in discussing deprescribing with your doctor, approach it as a collaborative exploration. Say something like, I've read about medication review for older adults and wondered if we could look at my list to see if everything is still necessary. Most doctors will be receptive to this conversation. Let's talk about red flags that suggest you need a more urgent medication review. If you're experiencing frequent falls, new confusion or memory problems, significant fatigue that's affecting your daily function, dizziness especially when standing up, or any symptom that developed after starting a new medication, contact your doctor promptly. Don't wait for your next scheduled appointment. If you're taking medications prescribed by multiple doctors who may not be communicating with each other, that's another red flag. Make sure you have one physician, usually your primary care doctor, who knows about all your medications and coordinates your care. If you're taking medications that were prescribed years ago and haven't been reviewed since, it's time for a comprehensive medication review. Your health status changes, new medications become available, and research evolves. What was the best option 5 years ago might not be the best option now. Here's a practical action plan you can implement starting today. First, gather all your medications, including prescriptions, over-the-counter drugs, vitamins, and supplements. Write them down with doses and frequencies. Second, note any symptoms or concerns you've been experiencing, even if they seem minor. Third, schedule an appointment specifically for medication review. Tell the scheduler that's the purpose so adequate time is allocated. Fourth, prepare your questions using the 7 conversation topics we discussed. Fifth, consider bringing a family member to the appointment. Sixth, take notes during the appointment or ask if you can record the conversation so you can review it later. After the appointment, create a clear medication schedule that incorporates any changes. Set up systems to help you follow the plan reliably. Follow up as recommended with any blood tests or monitoring your doctor suggests. I want to address one more important topic: the role of cost in medication decisions. Medications can be expensive, and cost sometimes prevents people from taking medications as prescribed. This is crucial information for your doctor to know. If you can't afford a medication, tell your doctor. There may be less expensive alternatives, patient assistance programs, or other solutions. Taking partial doses or skipping doses to stretch medications can be dangerous. Your doctor can only help solve cost problems if they know about them. Patricia is 66 and was skipping doses of her blood pressure medication to make it last longer because she couldn't afford refills. Her blood pressure was poorly controlled as a result. When she finally told her doctor about the cost issue, they switched her to an equally effective medication that was available as a generic for a fraction of the cost. Her blood pressure is now well controlled, and she can afford her medication consistently. Never let cost prevent you from having honest conversations about what you can and cannot afford. Your doctor and pharmacist want to help find solutions. Let me share some encouraging statistics. Research from the American Geriatric Society shows that when older adults actively participate in medication management, including regular reviews and open communication with healthcare providers, they experience fewer adverse drug events, better medication adherence, improved quality of life, and often reduced overall medication burden. You have more power in this process than you might realize. Your observations about how you feel, your reports of symptoms, your questions about medications, all of this information is valuable data that helps your healthcare team provide better care. Think of medication management as a skill you can develop. Just like you've learned other skills throughout your life, you can learn to be an effective advocate for your own medication safety. It starts with awareness, continues with education, and improves with practice. The goal isn't to become a medical expert. The goal is to become an expert on your own body and experience, and to be an engaged partner with your healthcare team. Now I want to address fears directly. Some people worrying that if they question their medications, their doctor will think they're being difficult or won't want to treat them anymore. A good doctor will never respond this way to genuine questions and concerns. If your doctor isn't open to discussing your medications, that's feedback about the doctor-patient relationship, not about you being difficult. You have every right to understand what you're putting in your body and why. You have every right to report side effects and request alternatives if something isn't working well for you. You have every right to participate actively in decisions about your health. This is your body, your life, and your health. Some people worrying that discussing medication changes will lead to their conditions getting worse. This is why you never make changes on your own. All adjustments should be made with medical supervision and appropriate monitoring. When done properly, medication optimization often leads to feeling better, not worse. Here's what I want you to remember from this video. Medications are powerful tools that can dramatically improve health and quality of life when used appropriately. As we age, our bodies change, and our medication needs may change too. Regular review and open communication with healthcare providers ensure medications continue to serve us well. You are an essential part of your healthcare team, not a passive recipient of care. Your observations, experiences, and questions are valuable contributions to your care. Every medication you take should have a clear purpose that you understand. If you experience concerning symptoms, don't assume it's just aging. Ask about medication connections. There are often multiple ways to treat a condition. If something isn't working well, alternatives may exist. Start today by creating your comprehensive medication list. Schedule a medication review appointment with your doctor. Prepare your questions using the framework we discussed. Be honest about symptoms, concerns, and cost issues. Follow through with recommended monitoring. Stay engaged in your care as an active partner. Your relationship with your medications should evolve as you age. What worked at 60 may need adjustment at 70 or 80. Regular review ensures your regimen continues to support your health goals and quality of life. In the comments, I'd love to hear about your experiences with medication discussions. What questions have you asked your doctor? What changes have improved your quality of life? What challenges have you faced? Your experiences can help others navigate their own medication management. If you found this helpful, please share it with friends and family members who might benefit. Subscribe to our channel for more content about navigating healthcare confidently as we age. Next week, we'll discuss how to prepare for medical appointments to make the most of limited time with your doctor. Thank you for watching and for taking an active role in your health. Remember, good healthcare is a partnership. You bring essential information and perspectives that no test or exam can provide. Your voice matters. Use it.